going to deal with the editorial discussion and the news analysis from Hindu newspaper, and the topics are just fine and the community and health issues of concern. This is important in GS paper 2 as well as GS paper 3. Our first article is just fine. This is from GS paper 3, environmental pollution and degradation and the environmental impact assessment. Justice for environmental crimes must be dispensed quickly and equitably. Now, the Union Environment Ministry is tasked with safeguarding India's forests and its environmental assets. Also, it proposes to amend sections of key environmental legislations and make them less threatening to potential violators. And there are 8 cornerstone pieces of legislations which defines the regulatory framework. It is to ensure that natural resources are not wantonly exploited. So this is to prevent the exploitation of our natural resources and also for the prevention of the pollutions. And this is a mechanism to punish and deter the violators. So under these new provisions, the existing legislation, so under the provisions in the existing legislations, the violators are punishable and with imprisonment of 5 years or with fine up to 1 lakh rupees is there. Sometimes both the 5 years of imprisonment and also 1 lakh rupee fine will be imposed to the violators. If the violation is continuing again and again, then there will be an additional fine of up to 5,000 for every day during which such failure or the contraventions continues after the convictions. So this is the main task which is safeguarded by our Union Environment Ministry in order to safeguard our India's forest and the environmental assets. It is to amend the sections of key environmental legislations and make them less threatening to potential violators. So there are 2 provisions that are there: imprisonment for the 5 years, or there will be a fine of 1 lakh rupees, or sometimes the both will be applicable to the violators. So the main aim of the new amendment is it is to make the fear of imprisonment for simple violations. Then the people will hesitate or people will think about before going to the violations or before going to destruct the natural resources. So this is the main aim of the new amendment. Therefore, we have such violations invite only the monetary fines. The serious environmental crimes that cause the grave injury or the death would invite the imprisonment under the Indian Penal Code, and these penalties will be decided by an adjudication officer and transferred to an environmental protection fund. And moreover, the quantum of potential fines has been raised from beyond the 1 lakh rupees to as much as 5 crore rupees. So here it is raised, the potential fine have been raised from beyond the 1 lakh rupees to as much as 5 crore rupees. So these proposals are not yet law and have been placed in the public domain for the feedback. So the proposed amendments do not cover the destructions of the forest and wildlife, which make up a substantial fraction of environmental crime and would continue to invade the existing penal provisions. So in this proposed amendments, it is just continue to invade the existing penal provisions and which is not cover the destruction of forests and the wildlife. And the United States and the European Research on Environmental Crime, which suggests that fining is the most common mode of punishment rather than the imprisonment. And also India has a long history of cooperative violations as well as a woefully slow redress system. There have been conducted an analysis by the Center for the Science and Environment. It found that Indian courts took between 9 to 13 years to clear a backlog of cases of environmental violations. So justice will be late. So the Indian judiciary, means our Indian courts, is taking between 9 to 33 years to clear a backlog of cases for the environmental violations. So it will not clear the issues. So starting from 2018, close to 45,000 cases were pending for trial and another 35,000 cases were added in that year. So more than 90% of cases were pending for the trial in 5 or 7 major environmental laws. So all these things will be lead to the letting of the justice for the environmental crimes. Except in this basis, the fines would be theoretically held with faster redress. So in order to get the faster redressal mechanism, the fine is theoretically important or which is helpful rather than other imprisonments, because already the cases are pending in our court. And our effectiveness of environmental regulation is very poor, and also the threat of imprisonment might have acted as a deterrent in India, and the justice for environmental crimes must be dispensed quickly and equitably before tinkering with the law to make it less forbidding. So these are the main issues about the environmental justice in India, regarding the environmental crimes in our justice. Means more than 90% of cases were pending in our trial, and it is by the analysis by the Center for the Science and Environment. They found that Indian courts have to take 9 to 33 years to clear a backlog or the backlog of the cases for the environmental violations. Article is community and a health issue of concern, and this is relevant in our GS paper 2 for the welfare of the vulnerable sections and the issues relating to development and management of social sector services relating to the health, education and human resources. The vulnerable section in our society, that is the LGBTQIA, means the lesbian, gay, bisexual, transgender, queer questioning, and asexual gender, and also the intersex. So they are suffering from long-term mental illness as well as further complications in our society. And also there was recent celebration of Pride Month. It is a celebration, means it is the annual celebrations. It is in order to honor or to work to achieve the equal justice. So we know that LGBTQI is struggling or suffering for the equality and also the equal justice, equal opportunity of lesbian, gay, bisexual, transgender, and the questioning Americans. So lots of things are happening in them in our society. So this Pride Month is celebrating in order to for the or in order to get the equality. The LGBT community, we know that these are the vulnerable sectors and they are internalized stigma and they are deeply internalized, and they are in fearful, means they are living in society in fearful, and they lost their self-worth or the self-esteem, and they started hating themselves and suffering lots from our society. These all are mainly because of the deep-rooted stigma. Lots of prejudices are there, factors or the beliefs are against the LGBTQ, and lifelong dissonance are there, discrimination or other sexual abuse or other physical abuse from the community. So these things will leads to the poor mental health of the LGBTQ community or the persons in this community. The LGBTQ also have the same mental factor like all the persons. They are facing lots of different from others from the social factors or the society. So society is influencing them more in case of their mental illness. So their identities, social context and discriminations, these all factors give them stresses, and it will directly impacting their mental health even if they are in young age. In order to prevent all these factors in our society, means the violence against the LGBTQ, it is must we have to implement or introduce the sexual orientation and the gender identity in our educational system as well as familial environment. Heteronormative. So heteronormative society is the major aspect of the issues mainly related to the LGBTQ. So a heteronormative society means it is a view that promotes heterosexuality as the normal or the preferred sexual orientation. If someone is rather than or other than this heterosexuality, they will face the social stigma or other prejudices from our society. That by all these factors, it is really hard to come out to yourself or ourselves and forget what others said. So this is very difficult for the persons who are in vulnerable community. In the LGBTQ communities, they also suffering from the caste, class, and also the religious affiliation. So it further leads to the mental impacts. It is very difficult to find friends and family who understand what the person feels. In every sense, the society thinks that the person is remains an outsider. They will not consider him as normal or her as normal. So they will further affect by the social factors and leading to furthermore health issues, physical abuses, like all the factors will affect, and this will lead to the vulnerable mental health of the person. If a person's gender identities are different from the sex assigned to them at birth, this conflict and othering is extreme. The person feels trapped and conflicted, and that needs their gender dysphoria. Factors will lead to the homophobia. So homophobia means it is a dislike or a prejudice which is against the LGBTQ people. So it is not a surprising factor that the LGBTQ people or the youth are likely to suffer more anxiety and depressions than the rest of our society. While the transgender community is even more vulnerable as its members suffer more than the LGBTQ together, means more than they suffer more than 2.4 times higher anxiety and depressions. But the family or the society, they will not understand, they will never understand about the mentality of the person. They are just facing on the social stigma or what others tell about the sexuality, what others tell about the gender, what the social status. So these are the important matters that affecting the LGBTQ. Large majority of the psychiatrists in our society, means especially in India, still consider that diverse sexual orientations are some health issues or some disorders, and they just practice the correctional therapy like ECT. ECT means it is an electroconvulsive therapy. They will give shock to the persons. They just diagnose that they have some disorder and they have to undergo these factors, and also they will administer some psychotropic drugs and some anxiety drugs and other disorder drugs will they administer, so it will further affect them mentally. There was a project called Rahat project. It found that large number of trans and gay men prefer to pay and seek in help in private sector. So the transgenders and the gay, they are preferring in private hospitals or the private sectors because they are facing more harassment and stigma from the government healthcare. So this is a very bad news that the person have to approach the private centers or the private sector in order to meet their health factors or the health services, and the government and from the government healthcare sector they are getting more harassment and stigma. So this is according to the Rahat project. How then do we build communities that sustain the good mental health of LGBTQIA communities? And what we need is a national focus on LGBTQI mental health that has become further aggravated by the global COVID-19 pandemic. So in order to achieve them or to get them health service factors and also to relieve from the social stigma, we have to take some long-term solutions like that make cure mental health a priority and address the community needs, but also engage everyone to change the environment which they exist, that is the participation of the society. So this is the first comprehensive long-term solutions that the government or the persons or the authorities have to adopt. So there must be the participation of all stakeholders like the educational institutions, communities, healthcare providers, mental health professionals, and the police personnel, and also the family. So these are the key source of mental health stress. So the harassments from the educational institutions and also the community or as well as society, healthcare providers. We know that they are getting more issues from the government hospitals, and also the mental health professionals also think that the sexual disorientation, it is like a sexual disorientation or this is a disorder. So these are the key source of mental health stress. So in order to prevent this, we need the complete participations or the active participation of these stakeholders. And we know that this is not easy as it's not a priority for the government and funding agency, and also this is neglected in society. So we need the awareness program and better health education programs in order to get rid of all these stigma. If we want to prevent all these social stigma about the LGBTQ community, we have to introduce all these aspects about the mental health issues in schools as well as universities. It is for the diverse gender and sexual identities. So this is an important point. Otherwise, we can't get rid of the social stigma. And also the key aspect is building self-care skills among the queer adolescents and the youth. Strong components of behavior change as well as the awareness. This is the important capacity or this is the important way it is to build the agency among these youth populations. to achieve the non-discrimination and the public awareness in order to change the social attitudes. The community building, it is an important part of improving the mental health of LGBTQI people. We know that the community, it includes even the health workers, police officers, and also the students, and from family, other communities, all from all the level, they are affecting lots of issues. So this is an important part of improving the mental health, but through the community awareness or the community participations. So we need to create a supportive, safe and educative space. It is to access the points for healthcare and information on the mental health. So one project is there, we already discussed about the project, that is the Rahat project. It has been working on through participatory methods and has opened a host of issues that LGBTQI communities face in leading colleges on an ongoing basis. So the issues, the Rahat project is mainly dealing with their issues and the awareness and other steps relating to the LGBTQI communities. So the change is and the challenge is on how to address these issues in a holistic way when institutions are so queerphobic. Queerphobic means the institutions are mainly against the LGBTQ. They are mainly against the queer. They have just prejudice about the sexual orientations and the social status. So this is a very challenging aspect, means how we will introduce all these matters or all these concerns to the education institutions or other institutions in our society. We know that LGBTQI, they are also human beings. They also have the same aspects of life, and also they have the physical, emotional, as well as all the part of life is just equal to other humans. If we are continuously ignoring this category or continuously affecting their mental health, it will lead to a great loss to a society, because they are also a human resources. They have the productive capacities for the development as well as the community participations. So without addressing both the preventive and supportive aspects of the mental health of LGBTQ people, we will compound an already neglected problem of mental illness that will be hard to handle in the future. So in order to combat or in order to control the mental illness or to prevent the issues in LGBTQ, we have to take the measures from preventive and supportive aspects. This would not just be injustice, it also a crisis which is created by deliberate neglect. So we have to care about our people. LGBTQ also is also a category in our society. They also have the equality. They also have all the opportunities, the things we are experiencing. This is the end of our today's discussion. I hope you all understood. Thank you.